Dear brothers and sisters, this video documents Dattatreya Ayurveda's work on infectious diseases. This video is made to bring awareness on Ayurveda's clinical potentiality in managing infectious diseases. This presentation will first give background information about us. We will then describe our work during dengue epidemic and chikungunya epidemic. We will also present a case study of Japanese encephalitis and about treatment of hepatic coma patients. Our institution, Dattatreya Ayurveda, is named after our Guru, Swami Dhananjaya Dattatreya Dev. Swami Ji is the current head of Dattatreya Heritage. Dattatreya Heritage has preserved Ayurveda in its pristine form for 3,500 years, making it the oldest living Ayurveda school in the world. Our institution, Dattatreya Ayurveda, functions under a trust registered in Kerala. The managing trustee is our chief physician, Vaidya Ratnam, Dr. Raghavan Ramankutti. He is the fifth disciple of Swami Dattatreya. Dr. Raghavan was traditionally educated and trained in Ayurveda for more than 14 years in the Dattatreya Ashram. His education involved study of Vedas, the 6 branches of Indian philosophy and Ayurveda. At the end of his Ayurvedic education, he was bestowed the title of Vaidya Ratnam, or the jewel among Ayurveda physicians, by his teacher. Dr. Raghavan is also qualified in modern medicine. He has dedicated his last 6 decades of medical career in handling chronic and critical disorders without established cure worldwide. He treats successfully diseases like multiple sclerosis, Guillain-Barré syndrome, multiple spinal discopathy, etc. only with Ayurveda. Dattatreya Ayurveda has also worked during several disasters and epidemics as listed in this slide. However, I will focus on describing our work on infectious diseases alone. Number 1. Dengue Epidemic Management Project. Dattatreya Ayurveda conducted several camps for dengue epidemic in the capital city of Delhi in 2015. 3 follow-up surveys were done to document the changes in symptoms and the quality of life of our patients. Around 77 patients gave consent to respond to these surveys. We conducted 2 follow-up surveys over phone, 2 months and 4 months after the medical camp. We could get feedback from 82% of the patients who agreed to participate in the survey. In the follow-up surveys, these participants reported that they had experienced symptoms of fever, cough, vomiting, headache, loose motion, abdominal pain and inflammation at the time of the camp. 83% said that they no longer have any of these symptoms now. 83% of the participants said that their sleep quality and appetite improved and they feel stronger than before. The average time to start experiencing these differences were reported to be between 2 to 4 days of having our therapy. 90% of them said they continue to enjoy the strength even now and they had no other medicines along with our treatment. Almost 98% of them said they experienced no side effects after having Dattatreya Ayurveda medicines. We also conducted a door-to-door survey using SF36 Quality of Living Survey tool. This was done 6 months after the camps. We could approach 53% of the persons who gave consent to participate in the follow-up surveys. More than 90% of these persons had problems in physical functioning before our camp. This includes moving or cleaning houses and walking for about 1 kilometer. Around 76 to 88% of them reported that they experienced no such limitations now. Also, 73% of them said they had problems in bending or kneeling before our treatment. However, 85% of our patients reported that these symptoms had disappeared. 83% of patients had severe pain before the camp, which disappeared after our treatment. Similar significant positive effects were reported in their physical and emotional well-being too. Patients also gave us written and video testimonials to express their gratitude and positive effects of treatment. Video testimonials can be seen on our YouTube channel. Dr. Raghavan also recollected his experience in handling around 7 patients with very low platelet count between 5,000 to 10,000. These patients were treated earlier in AIIMS, but repeated transfusions did not increase their platelet count. They even developed bleeding symptoms. They were given only oral Ayurvedic medicines and all of them improved. We have testimonials as proof from few of them. Let us now move to our work during chikungunya epidemics. We conducted camps for chikungunya patients at Barsana in Mathura and in Kerala. Barsana was severely affected by chikungunya and dengue in 2016. Since the locals were from very poor background, they were also severely undernourished and dehydrated. So apart from oral Ayurvedic medicines, we had to give them IV fluids too. In Kerala, there was an outbreak of chikungunya in 2006-2007. We actively worked during this epidemic. We conducted 72 camps treating around 20,000 patients. Camps were conducted in different districts with the help of local government officials and patients. MLAs like PC George wholeheartedly helped us. In the initial few days of the epidemic, patients who came to the camps reported symptoms of fever, cold, generalized body pain, redness of eye. But as days progressed, patients who came to the camps started reporting aggravated symptoms of diarrhea, itching, light sensitivity, and increased body pain. There were also some patients with complaints of multi-system involvement like bundle branch block. There were others who had become diabetic after chikungunya treatment under modern medicine. Even 5 years after our camps, we saw patients with arthritis or paraplegia with history of chikungunya. We treated these patients successfully, that is, restored their motor functions, because we gave importance to the history of chikungunya in their current treatment also. We have uploaded several video testimonials in our YouTube channel where patients narrate their true experiences of having Dattatreya Ayurveda treatment. It's not a common feat to treat 20,000 patients within few months of the epidemic. It is noteworthy to mention that each of our patients was given a unique prescription based on the needs of their body. In that lies the success of Ayurveda. In that also lies the marked polarity in treatment approach of Ayurveda and Western medicine. Let me now explain a case study of Japanese encephalitis. It is a viral infection of the brain and is the cause of thousands of deaths in India. Children affected by encephalitis having complicated symptoms cannot be cured in modern medicine. We present a case study of a girl 6 years of age with Japanese encephalitis. She was in ventilator support, unconscious, and on tracheostomy. The modern medicine hospital treating the child insisted to discharge her as nothing more could be done to save her life. Parents approached us and Dr. Raghavan went to the hospital and examined her. He felt confident to save her life, provided ventilator support was continued. We arranged domestic ventilator system. We also started oral Ayurvedic medicines. The girl slowly regained consciousness. Even upon regaining consciousness, she could not speak or swallow. She was fed on Ryle's tube. Her whole body, especially limbs, were stiff and spastic. Her lower limbs were even deformed. She had no bowel or bladder control. You can clearly see her state from these photographs. These are the photos of the same child 2 years after starting our treatment. We even got a recent photograph. This clearly shows the clinical efficacy of Dattatreya Ayurveda. Also worked during the jaundice epidemic in Mumbai and Kerala. In the late 1970s, there was a jaundice outbreak in Kottayam district, Kerala, India. Dr. Raghavan was a senior resident at Government Medical College Hospital, Kottayam, working under Professor Dr. Matthew Parakal of Internal Medicine. In the hospital, several patients had gone into hepatic coma due to total liver failure. There is no remedy for this condition even now in modern medicine. Dr. Raghavan started administering Ayurveda. Results were good. Patients from other wards started requesting treatment in his department. Unfortunately, the news came in local newspapers. As a result, he faced opposition from hospital authorities as he was giving Ayurveda in a modern medicine hospital. To avoid problems for suffering patients, Dr. Raghavan boldly transferred 19 patients, including a pregnant woman, to his residence. Overnight, he arranged 20 hospital beds with IV fluids. He saved all their lives. In regard to the pregnant woman, there was a confusion whether to do cesarean, at least to save one life. Dr. Raghavan got consent from family members to wait. Both mother and the child were also saved. Since the incidents happened 5 decades before, we have no testimonials, but we have the recollection of Dr. Matthew Parakal, retired professor of medicine from Government Medical College, Kottayam. Dr. Parakal said he witnessed the work of Dr. Raghavan. In this contemporary world, people are not aware of the clinical efficacy of Ayurveda in the way it was practiced by our great Ayurveda teachers of the past. I hope this video has changed your opinion. I hope it has opened up the unknown horizons of Ayurveda medicine. If you like this video, please press the like button. This will encourage us to make more videos on spreading awareness on the clinical potentiality of Ayurveda. Please subscribe to our YouTube channel.